All right, let's get right into it. If you're prepping for the NCLEX, you already know that pediatric questions can be seriously tough. So today, we're giving you a special preview of how the Exam Coaches platform helps you absolutely master them.
Okay, so right off the bat, this is the big mental shift you have to make. The NCLEX isn't really a test of what you can memorize, it's a test of what you can see coming down the line.
And let's be real, the stakes could not be higher for your patient and, of course, for your exam score. Being able to spot those small, early warning signs is, well, it's everything.
So you see, it's not some trivia game where you just name the condition. You have to know what to do first, what to watch for like a hawk, and how to act safely. Let's see how that works.
Okay, let's dive into this. Why do so many awesome, really smart nursing students and grads get tripped up by these questions? What's the deal?
Well, it usually boils down to a few things. All these different conditions can kind of start to blur together in your head. It's so easy to miss that one subtle early sign of a major complication. But the biggest thing? It's that struggle to decide what is the absolute first thing I need to do. It's all about moving from just memorizing facts to actually applying them.
So here's the secret, if you can even call it that. Your ability to spot trouble before it gets out of hand and then act correctly, that's what the test is built to measure. It is a test of your clinical judgment, and for that, you really need a framework.
And how do you build that judgment? With a system. So let's walk through a few high-yield examples to show you exactly how the Exam Coaches method gets all this organized in your brain. We're going to follow a simple pattern. First, you recognize the problem, and then you prioritize your action.
First up, Nephrotic Syndrome. Now this is how we boil it down to what you actually need for the exam. You gotta recognize the key signs. That puffy generalized edema, especially around the eyes in the morning. You see tons of protein in the urine, which of course leads to low protein in the blood, and your brain should immediately flag high risk for infection. Those are your recognition points.
So you've spotted the signs. Now comes the real test. What's your first move? The Exam Coaches method is designed to train you to make that critical decision in a split second.
Okay, next up, Epispadias and Hypospadias. The NCLEX isn't going to ask you about super complex surgical techniques. No, it wants to know if you get the big picture. You recognize the issue, the urethral opening is in the wrong spot, and you know the priorities. Surgery has to happen before toilet training, and your #1 job post-op is all about urinary function and making sure that stent stays open. And boom, here's the priority question. What is the one thing you absolutely must check before this baby goes into the operating room? This is exactly the kind of practical, safety-first question the NCLEX just loves to ask.
All right, let's switch gears to a neurologic condition, cerebral palsy. Again, we focus on the red flags. Is this child missing their motor milestones? Is their muscle tone off, maybe too stiff or spastic? Are those primitive baby reflexes, like the Moro reflex, still hanging around way past 6 months? These are the signs you have to be able to recognize.
So, when you see that spasticity getting worse, what's your priority? Is it meds? Is it physical therapy? Is it safety? The framework helps you cut through the noise and find the best first action every time. Next up, neural tube defects. Now this is a big one. Recognition here is often immediate. You can literally see a defect or a sac on the spine. Your brain has to instantly connect that visible sign to 2 huge risks: infection of that sac and the potential for hydrocephalus, that's fluid on the brain. And that brings us right to the priority question. For this brand new baby, right here, right now, what is the single most important thing you can do to protect them? The answer is a very specific nursing action designed to protect that sac. And finally, for this preview, let's look at a connective tissue disorder, Marfan Syndrome. Sure, you can recognize the physical signs, that tall, thin build, long arms, skinny fingers, but the absolute, positively critical piece, the life-threatening risk the NCLEX will test you on, is cardiovascular. You must connect Marfan Syndrome with stress on the aorta.
So when that patient shows up with chest pain, what's your move? This isn't just any old chest pain. Given their history, this is a potential medical emergency. Your priority action here could literally save their life.
Okay, hold on. We just jumped from kidney problems to congenital defects to neuro conditions. But did you see the pattern? It's not about trying to memorize 5 separate diseases. It's about applying one single principle of safety across all of them.
And this is it. This is the core principle. From the edema and nephrotic syndrome to the visible sac in an NTD, you first recognize the signs and complications. Then you prioritize the safest, most appropriate action, and finally, you act. This is the core logic we build into every single topic inside Exam Coaches.
So, you see, Exam Coaches doesn't just give you a giant list of facts and wish you good luck. We actually train you for the test itself.
We train you to see the patterns, to spot those early warning signs before a small problem turns into a full-blown crisis.
More than anything, we train you to answer that fundamental NCLEX question. What are you going to do first? You'll learn how to instantly pick out the most critical nursing action, no matter the scenario.
And when you put those two things together, recognizing complications and prioritizing your actions, what do you have? You have true clinical judgment. The exact skill the NCLEX is designed to measure.
You have to burn this into your brain. It's not just about finding a correct answer. It's about finding the best answer, the one that keeps the patient safe above everything else. That is how you pass this exam.
Look, what we did here today was just a quick peek behind the curtain. The complete in-depth pediatric framework that connects all these dots and gets you truly ready for exam day, well, that's waiting for you inside the Exam Coaches platform.